Hi, good evening, everyone. Uh,
Good evening.
I think it's probably just she's from Zambia. If I'm correct, I think it's the first time that she's joining us. Lumbiwe, eh? And everyone else, yeah, we know each other. So, to those that don't know me, I'm Genevieve Songolo is the surname. I'm from South Africa, and welcome to the first period our menstrual health conversation discussion in 2022. Okay, so like I said, hello everyone, welcome, and yeah, let's get into this. So, just quickly checking with everyone. How has your week been? Just one sentence, maybe, of how your week has been. If it was tiring, say tiring, and maybe why, and take it from there. Who would like to go first?
I'll go first.
Okay.
My week was relaxingly beautiful.
Okay. Thank you.
Yeah.
That's nice. I envy you. Okay. Thank you, Emmanuel. Anyone else?
Yeah, my week was intense. Yesterday I had to shut down. Like no, I had to stop, take a breath, and today I continued. So I'm really glad it's a weekend. Yes, I had a gender training, a 3 days physical gender training, and it was quite intense. Much as I learned so much, and it was totally worth the experience. Well, at that my regular job, it was quite a lot because coming from a week, last week was really intense for me also. So it was a tough week, but I'm just glad it's come to an end. Yeah.
Okay. I At least you have a weekend and you'll rest, and I hope you properly shut down. Don't take any
Yes.
calls. Just sleep, bath,
Mm.
wake up, eat.
No outreaches this weekend. I promise.
Okay, no, that's good. Thank you, Linda. Anyone else?
Yeah, my week has been relaxing as well. Just chilling out as well at home. Yeah, just go out once a while. That's totally indoors. Yeah.
That's nice. It looks like the men are having a nice chilled out week. Um, that's not fair, but okay.
No.
Hi, welcome, Annie.
Hi.
Hi, and you can tell us about your week.
My week has been a celebration. I recently got my results, so yeah. So I spent this week celebrating and feeling just a little bit proud of myself and accomplished. So yeah, it's been a good week.
Congratulations. Thank you for sharing, Annie. Um, okay, and then me. Is there anyone else before I go?
So I invited a friend from Zambia. I hope she gets into this call.
My week was, I don't have words for it. It was hectic. I just started a new job and I have to wake up so early. Um, but I'm happy to be employed. uh, it's a headache to get up because it's like really early, 3 a.m. in the morning to get up and get ready for it. And my body is not used to it. But yeah, um, we soldier on. Anyway, I'm not sure if I got everyone, but I think we need to get started. Yes, so we will talk about the, what do you call it, the effects of contraceptives on menstrual health and, lifestyle. For now, for me personally, I don't have experience when it comes personal experience when it comes to the effects of contraceptives on menstrual health. But what I challenged myself to do was I basically asked a few ladies what their experience has been, and I got some responses. But before I even get to my responses, I would like to hear from the team Um, what are your thoughts? What have been your experiences, perhaps? And also, we have a doctor in the house. From a medical perspective, what do you have to say?
So, okay, let me go first. Mm, when I started taking classes on going on outreaches, talking about menstrual hygiene and contraceptives and decision making, trying to stay in school and all that, I did have some questions from young people, and the question was similar. That's when I started knowing because I didn't know before. They say, why is it that when you go on contraceptives, your menstruation ceases? And because I had never tried it, it was confusing to me too. And I didn't know why that was. So I asked an expert, and she said, yeah, it's normal. It can happen that way, but it's not life threatening. Until last year, for the first time, I tried it. And for me, strangely enough, I didn't care the fact that it ceased my period. I cared about the fact that it made it stop paining me. Like I used to experience this very painful menstruation, and for the first time I wasn't feeling any pain. And of course it can seize it for as long as 2 months, and I was relieved. I didn't care about any side effect. I just cared about the fact that I can go 2 months without having to deal with menstruation and the pain that comes with it. Then I started asking myself this question: is this okay? I've been celibate for a while now, and I don't want to take off the implants because I'm spared the monthly torture, and I don't have to go through my cycle for almost every 2 months, sometimes almost 3 months before it comes and it goes. So I don't know if this is a bad thing, but I'm just relieved. So that meant that the girls that always ask me these questions, they didn't lie. I remember a particular girl who said has she bleeds heavily and it's become scary, and I think she said she had to take it off at some point because her flow continued. It wasn't stopping at all. I didn't have any experience like that. I think the first one went for about 12 days. After that, the next time it came, it was 5 6 days, and it was fine. So I've not had any reason to be worried aside the fact that it can take 2 months, which is a blessing for me because I get to rest. So the experiences are different for different females. So it's definitely a conversation to be had. Why this is so, and if it's safe, and when does it become unsafe to take it off? How long should one really go without seeing your period while you're on contraceptive? And then also, I noticed contraceptives aside, lifestyle can also mess with it. Going on a diet, for personally, it happened to me. The moment I switch my diet, I'm trying to try a weight loss stuff. My period can just delay. It might take extra 3 weeks, then it eventually comes. Same as exercising. So for a female, different things can actually, yes, influence our flow. I look forward to hearing from the others.
Now, I was saying that, thank you, Linda, for sharing. And the Joe just shared a question via chat where he asked, what is contraceptive, or what is a contraceptive? So I'm willing, or I'd give it a try. I did a bit of research on Google, of course. From what I got from Google is that, a contraceptive is an intentional prevention of conception, which is pregnancy. Right? Okay, let me just admit this person. Let me see. Okay, so it is intentional prevention of conception / pregnancy through using various devices, sexual practices, chemicals, drugs, or surgical procedure. Right? So that's what contraceptives are. So in my own words, I would describe it as methods used to prevent one from getting pregnant. Right? To prevent a lady from getting pregnant.
Yes.
I hope that makes sense.
Yes, that's exactly what it is. Contraceptive is just anti-conception, just preventing pregnancy.
All right, we have it from the doctor there. All right. Does anyone?
Yeah, my friend from Zambia is in here. I'm excited.
Oh, ala.
Inongi.
Hi, welcome to those that just joined, Petro and Nongi, right? Welcome.
Hi, thank you guys. And I'm just here listening. I will drop off because I got a call at 8:45. So,
All right.
but listening, quite interesting.
Okay. Thank you for joining us. You are also welcome to share your thoughts on this topic. Does anyone else have thoughts, questions, maybe? All of that is welcome. So, contraceptives are just like anti-conception methods.
I'd like to share something. Can you get me?
Yes, we hear you.
Yes, yes.
Yes, we can.
All right. So contraceptives would be anything that a woman, even a man, would do that are sexually active would do to prevent the occurrence of pregnancy. So there are, from my knowledge, like different types of contraceptives. There's the hormonal contraceptives, and then there are the natural methods, which would be like pulling out, condoms, abstinence, which is the absolute contraceptive. So yeah, contraceptives vary, and there are others that have more of an effect on menstrual health than others. So it ranges from contraceptives that are hormone based, like they could be progesterone based contraceptives, they can be the IUD, it can be the disc, the ring, tying of fallopian tubes, all those kinds of things to following of the cycle, where you know your days that you're least fertile, pulling out, use of condoms. So yeah, that is what I would like to share. Yeah.
Um, thank you for that, Annie. And obviously, we're gonna get to the effects of it, right? And all these contraceptives that Annie just mentioned have their effects, right? But I see Petro's hand is up. Petro, you may go ahead, sir.
Hi, everybody. I'm so glad to be here tonight. Yeah, such an interesting conversation. Um, Contraceptive. Okay, so in my simple terms, contraceptives are all means. All means that well, human beings together. Well, it can be couples, and then or women generally use to prevent pregnancy. I think unwanted, like undesired pregnancies. That's for me, and I think that's where the question is, like the conversation is so far. So yeah, that's all I can say. Thanks.
Thank you, Petro. And I'd like to put the Joe on the spot. The Joe, what are your thoughts? What do you know?
Yeah, I think contraceptives are like you guys have said. Those are my thoughts. I was just wondering. I mean, when Linda was sharing her experience and how some of the people she meets were also sharing their experiences, that means that contraceptives do affect the menstruation. And I don't know whether it's a positive thing or a negative thing. I mean, she enjoyed it because she escaped the pain and everything, but I don't know whether yeah. So it would be good to hear from the practitioners what there is and whether it's good or bad or yeah, what we can learn. Thanks.
Thank you, Petro. So with regards to the effects also, so okay, so this is where I'm coming from or where I'm speaking from. So like I said, I spoke to a few ladies, and besides speaking to a few ladies, there is this app called Flow, right? So the Flow app, this is not me promoting the app, but okay. Um, the Flow app is where a person is able to track their cycle and whatnot. And then there are also chat rooms, right? in flow. And I went to the chat room of, the effects of contraceptives, and a lot of people mentioned there was a lot basically of what do you call it, negative effects that they had experienced. So I'll just name a few that a lot of them had in common. So they mentioned the following: it was weight gain, it was loss or decrease of their sex drive, it was acne, mood swings, dryness, nausea, an irregular cycle, spotting. Some of them, said that they felt suicidal. So basically, the imbalance in their hormones, made them feel depressed. Some suicidal. Some said that they had an increase in breast size. Some said that they had hair loss or they experienced hair loss. One said that she experienced blood clotting, and the others, they experience heavier period pains or heavier flows. Some obviously did also experience a decrease in pain, like Linda. So those are the effects that many of them have experienced. And it definitely, I think it really does have an effect on one's think well-being and just your life in general. Because if this thing that's supposed to be kind of like trying to help yourself, so maybe that you don't experience as much pain, and then you end up getting depressed or end up gaining weight. It definitely does affect your health. So Linda, since you were open with your what do you call it, your experience, how do you feel hearing these things or these side effects from that I just read?
I would say I feel definitely lucky that I don't get to experience those things. Somebody who the most scary for me will have been the increase in weight, the weight gain. I am not experiencing that. The only thing I'm experiencing is the skipping period. And another thing I'm enjoying is the fact that the pain is gone when it eventually comes, when I eventually get my period. So for me, I really do wish other girls to be this lucky, and for them, so that more girls can or females can consider going on family planning or taking contraceptives, just so that they can be careful and prevent unintended pregnancy because of the issues that comes with. Um, I don't know how I feel right now, really. Well, I think I do feel fortunate. So far,
Yeah,
nobody is saying the fact that it's skipping is life threatening.
yeah.
I feel lucky. Yeah.
That's, thank you. And I forgot to say that these experience that I mentioned here had to do with hormonal contraceptives, right? So, like Annie mentioned, there's hormonal, there's chemical, there is what do you call it, where you use devices such as the ring, the what do you call it, the little thing that is, I think it is injected into your arm or something like that. Uh,
Yeah.
yeah, so I have not heard or gotten any experiences outside of the hormonal contraceptives. So maybe the doctor can also just help us with this one, with hormonal contraceptives and the effects that it has on the well-being or the body of the
I
female.
didn't get what you said. Can you get that? Can you
Okay.
repeat that?
Okay. So I had mentioned the side effects earlier, right? And I also just explained that the side effects were from ladies or women who were using the
Mm.
hormonal contraceptive, right?
Mm.
And
Yes.
so my question to you was, okay, so these are the side effects, mostly negative side effects that they're experiencing. Why
Mm.
is that? What we know that hormonal contraceptives is the cause of that, but why?
Why Okay. Yeah, asking why is it that women experience those side effects due to use of these hormonal contraceptives, or
Yes.
uh, okay. So just like any other or these hormonal contraceptives are medications, are drugs basically. So just like any other drug, they have their advantages and disadvantages, or should I say adverse effects, which are unwanted. I mean, bad effects on the body, and we have side effects, unwanted effects. So I can give an example of implants. They have the disadvantages which are well known, such as I can give an example of headaches, breast tenderness, moodiness, which are a bit of less common disadvantages. But we have these. She's mentioned menstrual irregularities, like missing her menses. It's one of the most common effects of contraceptives, or should I say the main goal? Not really missing the menses, but yeah, I don't know. I'm sure you understand. You get it, right?
I think so.
Like it affects the periods in that way. The person gets to have menstrual irregularities as adverse effects. Well, depending on we are human beings with these different bodies we have. These drugs affects us in different ways. So for someone, it may be more of headaches than breast tenderness. For others, it may be more of these menstrual irregularities than these other adverse effects. That's how it is, depending on how well your body will tolerate the hormone or the drug, the hormonal contraceptive. Yeah.
All right. Thank you for that, Doc.
Can
I
I? Oh,
yes, you might.
sorry, just an addition. So because the whole menstrual cycle is governed by hormones, when you take hormonal contraceptives, hormones antagonize each other. The needs will stimulate the production of another, the overproduction of another will suppress the production of another. So if you look at some contraceptives that have, let's say, progesterone as the hormone, the main component of the contraceptive, there'll be effects where women will experience amenorrhea, or rather, like, where they miss periods or they only have spotting, they hardly have periods at all. So because progesterone is not, how can I put this, it's not produced in high amounts in females as compared to males, but because of this addition, it will then antagonize the female hormones. And then there is, the lining of the uterus, which makes up, when it breaks down, makes up most of the periods that women see. So progesterone would then have an effect on the lining of the uterus. The lining of the uterus will not be as thick as it should be because of the high levels of progesterone, and as such,
Yeah.
you experience very little periods, because the whole blood that we see is actually the egg itself is really small, but the blood that we see and the clots and things like that is the breakdown of the walls of the uterus and the blood vessels. So you see
Yeah.
things like that, things like um, weight gain, where if you're taking a pill that has very high levels of estrogen will increase your appetite. So maybe you're eating a little more than usual and you gain weight. So it's all these hormones and the effects they have on the body, depending on what level of hormones you even had prior to taking the contraceptives and things like that. Yeah.
Thank you, Annie, for that. That's very insightful. I watched a video sometime in this week that actually showed that whole process. That in fact, because it's an addition of a hormone, right? And like you said, that it antagonizes the other. Therefore, because that happens, there are processes that are prevented from happening. So in the video, it showed that when there was a hormone added, like the hormonal contraceptive, right? The process of, the egg leaving the, I just forgot the name of the thing. So the egg leaving that part and into the fallopian tube, right, is a normal
The ovary.
process. Yes, the ovary. Then that process would not happen, right? And because that process doesn't happen, then the walls of the uterus, they don't thicken as they should. They remain slim.
Yes.
And therefore, the spotting that would happen, right?
Yeah.
It explains the spotting. Now, in the case where the person is using hormonal contraceptives, and instead of them spotting or their periods, decreasing, they basically overflow, or it's worse than it was before they took the contraceptive. What, how do I put it? What causes that? Does that have to do with maybe the makeup of that person? I don't know if you, Dr. and Annie, since you are Dr. Annie, yes, if you have any explanation.
I didn't get your question quite clear.
Okay, so my question is, so in an instance, because I explained the process, right?
Yes, you explained the process. Yes, I got
yes.
that.
So in an instance where the opposite happens, where the person is not spotting, they are using hormonal contraceptives, but instead of spotting, they have an overflow of menses, or basically, it is worse than it was before they took the hormonal contraceptive.
So you're talking about menorrhagia, which is abnormal menses, more than the normal, excessive bleeding or prolonged bleeding. Okay, so most of these hormonal contraceptives, most of them cause amenorrhea, which is no menses, or oligomenorrhea, little menses, than the other one, more menses, excessive bleeding. Although they can cause menorrhagia in instances where, okay, for example, you described the process very well, right?
Yeah.
I'm sure you saw where the hypothalamus, there is a certain hormones that go to the pituitary gland that move to the ovaries, and then that happens. So if the hormones the person is taking are affecting the hypothalamus, for example.
Yes, they can.
I'm gonna try and raise this person. Sorry.
I think is only one in this world that can't affect women. They should do it for men.
Okay, you can go on, Doc. Sorry about that.
Yes, and that's okay. As you you explained the process very well, as I was saying. From the hypothalamus will release certain hormones that will move to the pituitary gland, a gland found in the brain, which will release certain hormones that will move to the ovaries. Then the ovaries will release the egg. So usually, like you said, contraception just works by blocking those that pathway, anywhere along that pathway. Now you are talking of contraception. Hormonal contraceptives resulting in excessive bleeding or prolonged bleeding. In this case, it can be from if the hormonal contraceptive is affecting the hypothalamus gland. In this case, I read an article where what we call hyper means high, hyperparathyroidism. It may cause what you call hyperparathyroidism, like increased work, like the hypothalamus work, produces more hormones than it should, which will result in more release of these pituitary gland hormones, the gonadotropins, which are follicle stimulating hormone and luteinizing hormone, which will result in more production of or should I say fast maturation of these guys, the eggs, the ovaries, the ova in the egg, in the ovaries. So a person might find a person having maybe menses twice in a month, or going maybe at a prolonged period like that. That's just an example of how contraceptive pills might cause abnormal menses, increased bleeding.
Yeah, thank you for that, Doc. It makes sense now. Are there any questions or comments from from the rest of us?
Just an
Yes.
addition.
Oh, sorry. Yeah, go ahead.
So whenever most women come to the health center or the clinic or the hospital and they want to start on contraceptives, it is a whole procedure, because firstly you're supposed to take all the information, things like their age and stuff like that, what kind of job they do, their history with contraceptives, whether they've had kids before, the illnesses in their family, such as high blood pressure and anemia and things like that. I feel like most people are not exposed to, you know, how we've already established the fact that periods in most cultures, African cultures, equals taboo. So for some people, they do not even know what the normal period is, so to say. For them, their personal period is the normal. So let's say this woman who bleeds for like 7 days heavily, because the standard is that if the normal is that if you're going to have fully soaked pads in a day, it should be 3 changes. So above 3 fully soaked pads in a day would be excessive bleeding. So for some women, because this is the period that they've been having all along, they wouldn't even know. Let's say that you put this woman on a contraceptive, right? You ask her, how's your cycle? She says, no, it's a normal 30-day, 28-day cycle. And I bleed for like 5 days. And you're like, how's your flow? And they're like, no, it's normal, it's fine.
Yeah.
Because that is their normal. So let's say you put this woman on a progesterone pill as contraceptive, and then their flow reduces. For them, that would be alarming. So imagine their flow reduced because of the progesterone, but it actually stabilized, you get. So the woman would be under the impression that her flow had reduced, or something was wrong, or things like that, when it had just stabilized. I feel like contraceptives are viewed as you're allowing people to have sex, people who shouldn't be having sex. I don't know if that makes sense.
Yeah, I think
It's like, why are you teaching these young women about contraceptives? So you're telling them it's okay to have sex as long as they don't get pregnant. But the truth of the matter is that they will have sex. Whether you do teach them about contraceptives or not, at the end of the day, they will have sex. What is better? You help them protect themselves from all these sexually transmitted illnesses, and you help protect them from unwanted and early pregnancies. And that helps. So I feel like there's not much, people know about contraceptives, but there's not much information out there about contraceptives and how they work. And most women just find out about contraceptives via emergency contraceptives, like where it's just, oh, I need a pill, I need a morning after pill, and that's it. So yeah.
all right. Thank you, Annie, for that. Again, that's
So-
really insightful.
I have a
I see
question.
that, excuse me. I see that Doc Lumbiwe has a question. If you don't mind, can you just hold on, Doc, and then Lumbiwe, you can go ahead and ask your question.
Yes, actually, it's a concern. I look at the issue of contraceptives that Anna's mentioned. Anna's mentioned the clinical scenario and the hospital family planning clinic. But now I begin to look at it from an angle, the challenges that would pose. Of over-the-counter contraceptives, I think this is where the biggest challenge has been. People just wake up and say, okay, I'm just going to the chemist. I'll not go to the clinic and all, especially when it comes to the morning after pills, which is being taken by a lot of young women because it's bought over the counter. And those people that are selling, they don't really care. They just sell. So I wanted to find out from the doc, what are some of the repercussions of abusing the morning after pill, especially by young women who are as low as 18 and so on. Thank you.
Thank you, Lumbiwe. Doc, Mr. Mwanza, would you like to answer that? I think before you do, from in South Africa, what happens, right, is with regards to the morning after pill, you have to go to the pharmacist. The pharmacist will ask you certain questions like how recent you've had it. You understand? Before they prescribe one to you. So I don't know how if that's the same procedures in our other African countries, but in South Africa that's the procedure. You also have to complete or fill out a form in order to get that. But Doc, the floor is yours.
Okay, so this we're talking about the emergency post-coital contraception, so which is indicated for prevention of pregnancy following unprotected intercourse. So basically, it has its long-term, it has its side effects, which can be short-term and long-term, and I'll mention a few which are common if it's abused, if this contraceptive pill is abused. We can have, as documented by Medscape, about these adverse effects which are greater than 10%. We have headaches, we have acne, we have ovarian cysts, enlarged follicles in the ovaries, we have amenorrhea, that is absence of menstruation, we have abdominal pain, we have vulvovaginitis, which is inflammation of the vagina and the vulva. Even ectopic pregnancies can come out as a result of abuse of this morning after pill. And we have these other things such as menorrhagia, dysmenorrhea, alopecia, and there are so many other adverse effects. Yeah, I want this to answer a question someone asked.
Yeah.
Someone asked the question, I think it's Linda. The question said, does it mean that other contraceptives that are not in form of pills are not hormonal? That is not the case. We have the types of hormonal contraceptives can be implants. We can have injectables. We can have the orals, the pills. Then we can have vaginal rings, patches. The hormonal contraceptives can come in all kinds of, in all different kinds of types. Yeah.
Okay. Thank you, Doc. So I think the next question that Annie had posed or asked was, are these contraceptives? I'm not sure if she's referring to hormonal contraceptives, but she asked, are they safe? Okay, you may go ahead and.
Yeah. So the thing with contraceptives is that safe is a vague word. So there are some that are better suited for other and some that are better suited for others. And just before I go there, let me touch a little bit where someone brought up the issue of over-the-counter contraceptives. I feel like the fact of the matter is that in other countries, like you said, they will ask you your history with contraceptives, your age, and things like that. But the common practice in Zambia, from my experience, is you walk in, you say, "Oh, I want this." They assume that if you know the name, you know how to use it. Because what are you doing there? They sell it to you, you get your change, you leave. Nobody explains, because there are different types. There are ones that are taken once off, the ones that you take a pill every day, and nobody is telling these women that you're supposed to take this pill at the exact same time. And if you miss a day, take two the following day, and things like that. Nobody is telling them this. So these women don't even know that, oh, maybe the reason my body is reacting this way is because I'm taking a hormonal contraceptive. There's this other option. You see, so what happens that even at the clinics, when a woman comes, you tell them, oh, so there is different types of contraceptives, and you advise. So let's say maybe this woman is a business lady and she travels a lot, and you say, so maybe this one where you need to take a pill every day, not so suitable for you. There's this injection for 3 months. I feel it would be best suited for you. After on the actual date or the day before, you come back and we give you another jab. And we tell the women to say, if you experience lightheadedness, nausea, a headache, those things are kind of normal, they're expected. If they exceed, let's say maybe leading up to a week, please do come back to the clinic, because this means that this contraceptive is not the best for you. And if we see that this contraceptive is not the best for you, then it obviously indicates that one that is a direct opposite of that one could be better, things like that. So now coming to the issue on which one is safer, it's an assessment of every individual. Like any other thing, they will teach us and they'll tell us every individual is specific, they are different. You can have two individuals, the same age, the same pregnancy history, contraceptive history, but they react differently to the same thing. So it's about choosing a contraceptive that works best for you, knowing that this is unbearable for me. I'm not going to be on this contraceptive anymore. I'm going to go back to the clinic, and I should be given I have the right to be given a safer contraceptive for me. So contraceptives are good, but if that contraceptive doesn't best suit you, it can be absolute hell for you.
That is really helpful again. Any comments from the rest of the group? It's awfully quiet here. Petro, any comments? Let me see who else is there. Welcome to everyone who just joined us. We are happy to have you. Yes, Petro?
Okay. Can I speak?
Yes, you may.
Okay, so here's my comment. Well, this all seems quite complex for me right now, so it's becoming more technical and I'm feeling kind of lost. It's an interesting topic. So, well, lots of technical terms being used right now, but I'm understanding. But then I just want to understand some things, like in simple terms, like in everyday words. Like, yeah, like to be honest, I'm really like skeptical about contraceptives that are injectable, like ones that actually go into your body and then they do affect you in a certain way. And these side effects, we call them side effects and we try to minimize them. For some women are very serious and they do alter their entire life, like the way they live, like the way they feel in their body. They feel different and then they have to behave also in a certain way which is different. So it changes the entire experience of life for some people. And this is something I have well, this is I draw this from experiences from people that's like, let's say, testimonies from people that's went through or are even going through these challenges. Wow. And contraceptives now are very common because everybody who's active, like sexually active, is aware of the topic, and they try to make sure they don't make a girl pregnant, or a girl doesn't want to fall pregnant when it's not the right time. So I think this is relevant, but then it's scary also. It's dangerous, if I can say. So if you can explain to us, what does it have, like what happens in the body? Like, yeah, you try to explain in your terms, and but I hardly understood. So I want to know what happens in the body when somebody's injected, or when they place this new there's this new thing, like it's a small device. I think you guys mentioned it. That's they put they insert into your body, and then you have to live with it. And I heard a story where um a woman like got sick, like right after she had that device in her body. She wasn't herself anymore, so she was sick. She had to be hospitalized until that thing was taken out. Then she was okay again. So I just want to understand those two things. Yeah, please.
Yeah. Thank you, Pedro, for that. I think based on what um, Doc said, right, Mr. Mons, and it is, different people react differently, right, to whatever it is, or in this case, to contraceptives. They react differently to it based on what goes on in them, be it hormonal, like the doctor said, he explained about the hypothalamus, and how the messages are sent to the rest of the body, and based on how the body receives that. Now we're talking about um, the, um, the reproductive system, based on how it receives that acts, right? I hope that that makes sense. Um, but if that is not satisfactory to you, it doesn't make sense to you, then the doctor can explain again. But before he does, if you don't mind, I noticed that the Joe has his hand up, or has raised his hand. So the Joe, if you don't mind, you may ask or comment, and then after that, I'll ask the doctor then to just explain the process he explained before in layman terms.
Thank you. Yeah, so I think it's been a wonderful conversation, very informative, like, yeah, educational. Thank you so much for all the inputs. And so for me, I'm just gathering, like Petra was mentioning, it's like a lot of people are resorting to the contraceptives as an easy avenue to escape pregnancy. We all know about this. What do they call it? Um, they have one that you use just before intercourse, and there's one that right after intercourse you can also take. They have all these kind of instant contraceptives or stuff that prevent pregnancy. And of course, there are those ones like the condoms and the long-term ones that you guys are speaking about. So I know there may not be a general answer as to like are contraceptives good or bad. I think it's because oh no, let me not say we are using contraceptives, my wife and I. We're using the similar to what Linda is using, the one they put in the arm. Yeah, she was recommending I should go sterile, but I was like, no, sterilization. I didn't think it was a good one.
No.
Yeah, often that is the reaction from African men. From African
Oh,
generally the black men. That is the reaction when it comes to, okay, so let's turn tables, right? So contraceptive is, I'm having reactions to it as the woman, or it's not working, whatever. So you try it, and then you're like, yeah, this is not my cup of tea. I did not sign up for this.
No,
That
but
that
you
has
know, the gentleman, ours is more permanent. The ladies, yours is temporary. It's temporal. So
yes, I
you can resolve
understand
a
that,
temporal issue with a
but you
permanent.
see the effects it has.
Hmm.
Some people, it messed them up. They became depressed. You understand?
Hmm.
So weigh the options anyway. It's not
Yeah,
difficult.
yeah, that
Joe, I have something to say about this. Like,
okay.
the maximum a woman can get pregnant in a year is twice. That's if she had a baby maybe in January, and it's possible she can also have another baby before December.
Hmm.
And a man can impregnate a woman every day of the year for 360. That means he can have. So why does the burden of not getting pregnant or taking care of not getting pregnant fall on the woman? Really, especially if a vasectomy, for example, is reversible. Why are more men not thinking, oh, I can do this? Especially, like I said, it's reversible.
Is it
Women go through a
reversible?
lot. This whole, yes, it is. You can Google it. Women go through a lot. I
Maybe not
mean,
in Africa.
tying their wounds, this whole, like, look at me now, I'm saying I'm happy. Like, I'm relieved. I'm not on this church December. I didn't have to bother January. Now I'm expecting it and I'm already frowning. And we have to do this.
Hmm.
So, what if more men actually are open to this option? And like I said, it's reversible.
Okay, I
Like,
think
I
most
don't
men
know.
are
It's
not
another
aware
conversation to
Wow.
have.
that vasectomy is reversible. Because maybe there can be a session on contraceptives, like male options
For
and female
men.
options. Yes, or probably specifically for men. I think that would be really cool because for us, dear, I don't know.
Yo, brother Joe.
I genuinely, I understand. I understand the fear, right? I understand the fear, and I feel like obviously more research should be done because I think it has just become like a woman thing. Women are bombarded with that, right? Because they're the ones that get pregnant. But almost very little to almost nothing is basically said about the men who can have 365 pregnancies in a year. Do you understand? So the scale it's not equal. You understand? Um, Nonetheless, I forgot what I wanted to say. I think it was an important point that I wanted to say. I just forgot it. But going back to the doctor, or to Petro. Petro, when I try to explain it as simple terms, did you understand, or should we still ask the doctor to explain it in more simple?
Well, yeah, I did, but I partially only. I'd love to hear from the expert also. Yeah.
Hey, expert, did you hear that?
Okay. Okay, so first of all, let's understand that it's just an interaction between certain glands and hormones. So it starts from the brain. In the brain, there's two important organs: the hypothalamus, what we call the hypothalamus, and what we call the pituitary gland, specifically the front part of the pituitary gland. So this guy, the hypothalamus, will release what we call a hormone called, it is abbreviated as GnRH, gonadotropin releasing hormone. Gonadotropin releasing hormone will move from the hypothalamus to the front part of the pituitary gland. It will stimulate the front part of the pituitary gland to produce two hormones which are called gonadotropins. These two hormones, which are abbreviated LH, luteinizing hormone, and follicle stimulating hormone, FSH, they somehow have two different functions. The first hormone that is released from the front part of the pituitary gland is FSH, follicle stimulating hormone. This hormone will move through the blood, go into the ovaries. Now we are in the pelvis now. There in the ovaries, it will, from the name follicle stimulating hormone, it will stimulate development and maturation of follicles. Follicles are basically, how can I put this? Just certain, can I say, they're like egg cells, like they contain the egg cells. Yes. So there in the ovaries, the follicles will develop and mature. And then at the same time, follicle stimulating hormone will cause production of estrogen. So estrogen is necessary for a lot of things in the female body, but during menses, it's necessary for production of receptors for the next hormone that will come, where the next hormone will come and sit in the ovaries. So estrogen has what we call a positive feedback on the hypothalamus. So when estrogen will travel through the blood again from the ovaries, it travels from in the blood from the ovaries and goes to the hypothalamus. It will again stimulate the hypothalamus to release follicle stimulating hormone. Gonadotropin releasing hormone. That hormone again will come to the front part of the pituitary. This time will cause release of the other hormone, luteinizing hormone, LH. LH will move down again through the blood to the ovaries. There in the ovaries, it will find that they have already prepared receptors where it can bind. Okay, so by binding, I mean where it can sit, attach. So luteinizing hormone will attach to its receptors, and then it will cause production of progesterone, the other hormone which is necessary for ovulation, now releasing of the egg. So ovulation will occur. Then, in short, all this I've explained is just divided into 3 phases. There's the follicular phase, where I said the development and maturation of the follicles, which is brought about by this hormone, follicle stimulating hormone. And then there's ovulation, which is brought about by luteinizing hormone and progesterone. And then there's now shedding of the uterus if implantation does not occur, because fertilization has not occurred. So the woman will undergo that monthly shedding. Yeah, so that's just it.
Thank you, Doc, for that. Hetero, I hope you understand, and those maybe who haven't. But there's information is readily available on YouTube that kind of explains this process that Mr. Martin just explained. And I wanted to go back to a statement that was made, I think, by, if I'm not mistaken, it's either the Joe or Petro, right? And the statement that was made was that girls or women, they use contraceptives mainly, right? Especially girls, to prevent pregnancies. That statement is not entirely true, right? Yes, the goal is not to get pregnant, but some, right, or a handful of them use the contraceptives as a way to, it's a temporary cure, if I may say so, period pains, right? So I think from our previous talks or discussions, we have complained about severe period pains, and you can't always be consuming painkillers and whatnot. Do you understand? So for some, they use it as a way to temporarily cure the period pains. As you've heard Linda share that, ever since she started using contraceptives, she's happy. She does not stress anymore or worry about period pains. She's just living her life. So that's one or some of the reasons that females use um, contraceptives. Yes, like anything else that exists on earth, there are people that will abuse these things. And I think what is important is, to get the information out there or to share the information with people so that as they make these decisions or before they make these decisions, that they have the knowledge of the possible effects or the long-term effects that they might suffer if they abuse this thing or they abuse contraception. And the other question I have, and anyone, I think maybe Doc or Andy, you'll be able to answer this. Does the use of contraceptives have a long-term effect in terms of would it affect the person getting pregnant in the future? Because I've heard stories of people that say that they've used contraceptives for years, and when they finally wanted to have children, they were struggling to have children, or they could not have them, or they would get pregnant or conceive, but they would not carry full term. How true are those things?
So I can slightly or briefly answer your question. So the thing is that this whole process that Emmanuel has explained, your body, because your body doesn't know when you take contraceptives, your body doesn't have a system where it can know where these hormones are coming from. And over time, if your body were to get too used to these contraceptives, that would become the normal. So, like, if you were taking, let's say, progesterone pill, a progesterone only pill, for let's even say 10 years, at that point, already the level of progesterone in your body is high. And it is suppressing the production of other hormones. So for some women, this all depends on the effects of the contraceptives on you. So let's say you've been taking this contraceptive, and from the beginning, you really had little periods. Like you skipped periods for 4 months, and when you did have them, you spotted for like 2 days. When you stop using this contraceptive after a prolonged period of time, your body is not going to magically bounce back. These hormones are in your system, they're in your blood, and they have influenced the production of other hormones by the brain. So in such a case, it could affect how soon a woman might conceive when she decides to conceive. Whilst for other pills, immediately you stop, within a month too, you may be able to conceive. So yeah, that's what I could share.
Okay, thank you.
Can I say something briefly about this?
Yes.
So at the end of the day, it depends on the woman again. When I went for mine, and it was as Mary Stopes, and the nurse was counseling me, and she told me, she said there is this popular belief that once you stop it, it takes a while to get pregnant. That personally, she doesn't believe this, because a lady came to the clinic, to the facility there, and she got the implants. A year later, she came, she wants to take it off. Why? She said she was getting married in the next 3 months. So she told her, okay, after your wedding, come and take this off. And she said no. Her mother told her it takes a while to get pregnant once you take out an implant. So she's trying to fast track it and save herself 3 months. She said she told her bodies are different. Don't do this. The lady refused, and of course, her client is right. She took out the implants for her. The lady came back in 4 months' time. The guy canceled the wedding and she was pregnant. So the very month she took it out, she got pregnant. So it really depends on the body. Everybody's different. See how I'm reacting to my implant. Another person might react in a totally different way. So that's what I think about this. Sorry, we have a power outage, so you can't see me for now.
Okay, it's not a problem. I just want to go to the chat screen.
Okay, so I would like to add on something. I think it depends on what type of contraception you're using, because there are some where contraception may return upon removal. For example, certain implants. Just upon removal of those implants, contraception may return. And then I know someone, a friend, well, this one was using an injectable, and an injectable Depo-Provera. She, after her last shot, I think about 9 months passed, and she still couldn't conceive. And it may, for this one, it may take up to a year, 12 months for someone to. It may take maybe just 3 weeks. Others it may take 6 months. Others it may take a year. For some, they might have these long-term infertility adverse effects. So it depends with the type of contraception one is using. It, as the previous speaker said, it also depends upon the person. Yes. I remember Joy used a statement which said you can't use a general term statements to say they are good or bad. No, it depends. This is me answering the question where he said, are they safe now? I think it depends with with proper medical history, proper monitoring, proper compliance. I think they can be safe. They are safe with proper everything. If everything is followed, every instruction is followed. But let's not disregard the adverse effects, the unwanted effects. They are there. Some can be exaggerated, others can be minor. So if the adverse effects are exaggerated, it's best you visit a health center. They would advise and help. If you feel they're minor and you can tolerate them, I think, yeah, you can continue. If it's bringing you the benefits, if the benefits outweigh the risks, continue with the contraceptive. If the benefits outweigh the risk, but remember, there are those adverse effects. Put in mind, they can come in any way. They can be short term or long term. Yeah, that's what I wanted to add.
Thank you, Doc. Also, from the comments I read from the ladies group, right, that I follow on the app that I mentioned earlier, some ladies, they would react differently to a certain type of contraceptive. So they would leave that and try out another, and then, they ended up finding the one that works best for them, or contraceptives that, maybe they previously, like I said, some of them, they experienced depression. Some were suicidal because of the depression, right? And so they got themselves off that one and tried another one and another until they found the one that, worked for them. So that statement, or what I'm saying, is just to confirm what you're saying. It is based on, how the persons make and whether the thing that they are taking or the contraceptive that they are using is working well with their system. So it's not a one size fits all. That's what I'm trying to say. Joe, how much time do we have left, if I may ask?
Oh, we can be running up now.
Okay.
It appears though that we spoke a lot more about the contraceptives and its impact on menstrual flow. We didn't touch much on the lifestyle So maybe we can just highlight a bit about the lifestyle component and whether what kind of lifestyle makes menstruation better, and how can the gentleman or the husbands, or yeah, what role can we help or play in making this a better? I don't know if I'm clear, but yeah, maybe just a few minutes on that, and then we can.
Please try to help me. I'm trying to find out if I get it correctly. So you want to know who you would like us to discuss what effects, right? Contraception with menstrual health has on how you live your life. Is that what you are asking?
No, rather, I think what we've discussed so far is how contraceptives impact on the menstruation or menstrual health. But we were also thinking about how our lifestyles, maybe the kind of lifestyle we are living, can also impact on the menstrual health.
Okay.
Yeah, but we didn't really touch on that. We could actually schedule that for the next meeting. That's fine. Or if you can spare some 10-15 minutes, we can as well touch on that.
I think we can try and do that within 15 minutes. So stress definitely it has an impact on one's menstrual health. So in my experience with stress, I've never ever missed my period, but I've had it twice in a month, right? And that was also because I was stressed. And I also know another female, she's a student. When she is stressed or for the duration while she's preparing for exams, right, to write her exams, she would not get a period at all until she's done and out of that mode of stress. So yeah, stress definitely has an impact or affects one's menstrual cycle. I hope that answers the question or addresses the question you are asking.
So I have a final question for a medical expert. With this conversation, if someone has never had taken a contraceptive, with all you said, will the person be scared just listening to all this? Will they be encouraged to want to try it out, not knowing what their lot will be or what will happen to them? So at the end, will you say it's safe or it's a risk they should take just to prevent unintended pregnancy? If you are to counsel a young person who can't abstain, what do you tell the person?
I would tell them it's safe to take these contraceptive measures, but not to abuse them. Yeah, because abuse will lead to some really bad adverse effects. But I would tell them. I would offer them the other. I don't want to say. I can say safer options. Yeah. Yes, because I've seen they're safe. I can say safer options than hormonal contraceptive methods. Although the barrier contraception, such as condoms, is also not as effective as it was meant to be, but yeah, it's still there. But I would tell the person, the person who can't abstain, to say they should try these contraceptive methods. They are not bad. They are safe. With, like I said, with proper medical history, monitoring, proper compliance, and if they are not abused, they are safe. And they'll achieve the desired effect just fine. Yeah.
All right. Thank you, Doc, for that.
There's also a question in the chat. It says, can sight of abundant blood affect a woman's menstrual health? I'm not sure if he's talking about like excessive bleeding. Can the sight of abundant blood affect sight? As like if the person sees blood. Helix, you can unmute yourself and explain your question.
Helix, are you there?
Yes, good evening. So I just wanted to know, in case a woman witnessed a kind of car wreck or accident, can the sight of abundant blood, or if she sees a lot of blood, can it affect or have an impact on her menstrual health? That is what I wanted to know. Is sight the fact of seeing a lot of blood can affect your health? Okay, thank you.
I'm not sure, but this is what I'm thinking, or this is how I interpret this is, look, a car wreck, blood, I think it would cause, trauma, and, that also goes hand in hand with stress, right? And as we had explained earlier, or where I shared my experience, that when I'm stressed, or in the instances that I've been stressed, I would maybe have my period earlier than I would have if I was not stressed, or have it twice a month. So I'm thinking that because of something that has happened and it affects her mentally, then maybe that can happen, that she would end up having a period earlier than usual. I don't know if that answers the question. But yeah, that's my attempt.
Well, I've never heard of this, but I mean, it's a huge world. Somebody might tell you, oh, whenever I suck blood, my period comes soon. It's possible. But scientifically, no, I've never heard about this. The one I know of is if there are girls in the hostel and somebody starts her period today, even if I'm expecting mine next week, there's a high chance that in the next 2-3 days it will come. It's when I experienced this in the hostel, and that girls were like, wait, it's not supposed to be time. How come just because this person started, I started feeling like mine is going to come sooner, and it did. And everybody seemed to be menstruating within 2-3 days of each of the other person starting. That's another one that I don't know how it works psychologically. I don't know what about that makes the fact that you're watching your friend having her period affects you emotionally and psychologically, and it triggers something, and your period comes sooner. This is another mystery I can't explain, but yes, it's real. On campus, then in the university, a lot of us used to say, okay, one of us is starting, everybody will soon start, and truly everybody will start. Medically, I don't know if there's a term for it, but it's just one mystery. So it's possible someone might also now say, oh, whenever I see sight of blood, my period comes shortly after. It's possible somebody somewhere is experiencing that. Never say never.
So, what Linda is talking about is something I've heard, which is called syncing, where, as you said, in campus, the girls are exposed to in the same environment, maybe the altitude of the area, the same similar diet. So you might find that if one of the girls start having their menses, the others will sync. It's just that they'll sync, because of the similarities in what the factors that they're exposed to. Yes.
Oh, okay. Yeah, I've heard of that term.
Just in addition to the syncing of periods, like he said, the ladies in the hostels, because they're in close proximity, they do everything together, they have a similar diet and stuff like that. Also, there are pheromones. Pheromones can easily cause syncing of periods. When you are very close to someone and you spend all the time together, your pheromones can actually sync your periods. Then on the issue of blood, you give an example of a car accident scenario. I've heard people, like Linda said, I don't know scientifically, but it is not something that has never happened before. We've had people who say, no, I saw period blood in the toilet, and soon after my periods started. Though to an extent, I feel like it also depends on where you are on your menstrual cycle. Because say you just had your period a week ago, and your cycle, you haven't even started ovulating yet, I feel like it's highly unlikely for period to be triggered. Even a day or two away from the day that you're supposed to start your period, and that happens because of things like stress or anxiety or just stimulation of your brain after seeing the blood. I think yes, it's a probability that your periods could be triggered.
Thank you, Annie, for that. And then I think this could be our last question. So the question posed here says, it is by Brenda. What is the link between oral contraception and anemia? Ne? Does the use of oral contraception increase the high blood pressure and stabilize anemia? So again, I think this is to the to the experts. Any comments, experts?
Sorry, I didn't get that question. Can you take it again?
Okay, so basically, Brenda is asking, is there a link between oral contraception and anemia? I know anemia to be someone who's got low iron, right? And then the second part of the question is, does the use of oral contraception increase the HB? I assume that is high blood pressure, and stabilizes anemia.
So I think we can reason from the fact that since oral contraceptives, the use of oral contraceptives is associated with reduced or decreased blood loss, it can be used in anemic, like oral contraceptives are associated with decreased menstrual blood losses. Therefore, they can independently reduce the risk of anemia. The other pathway I can explain is how is the effect of oral contraceptives on bones. As we know, blood cells are produced in the bone marrow, in the bones. So, in a way, they somehow increase the metabolism that occurs in the bones. Yeah. So that's in a way they help bloods to be increased in levels. Yeah.
Okay, so if I hear you correctly, Doc, you are saying that contraception helps with the production of blood in the bones.
Not really the contraceptives. It's okay. Yes, the hormones in the contracept. Yeah, if we're talking about hormonal contraceptives, the hormones they're involved in bone metabolism. Specifically, blood cells come from the bones. So in a way, I won't say I'm very much sure of that. I'm just trying to make a connection. In a way, that can be how they help in increasing blood levels. The other one is this fact why oral contraceptives are associated with reduced blood losses, menstrual blood losses. Yeah.
Okay, thank you, Doc. Thank you, Doc, for that. And we will take the last question before we give over to Petro to do a short summary in French. So the last question is, please, is it normal that after the period a woman has anemia even if her menstruations are not abandoned? I don't know if you are hearing that question, or maybe the person who asked the question, can they unmute themselves and explain further so that we all understand?
The question is that, is it normal that a woman after her period has anemia even if her menstruation are not abundant? It should be noticed that the woman don't use any contraceptive or any pills. Okay, thank you.
Okay, so when I realized that the what we call our period has something to do with the amount of blood in our body, was when a cousin of mine suffered what I think biblically is called a issue of blood. She was menstruating non-stop for 3 years, and it was so heavy that if she doesn't change her pad in 30 minutes, she'll be soaked through. Her dad had cartons of pad in the house, and for once she was never dizzy. She was a plump person and she was just normal. So I kept thinking, like, where is this blood coming from? It continued for a while, and thank God she's fine now. So I don't know. I'm not sure there is a relationship between period and anemia. It might be something else wrong with that lady. Because from her experience, I got to know how can someone be losing this amount of blood on a daily basis and she was never ill, physically ill, or ever felt dizzy. So it felt like it was the blood was being generated from a different part of her body that had nothing to do with the blood she needs to survive as a person, her blood vessel, pumping her heart and all that. So let the doctor answer this. Well, this is just something I needed to share.
Maybe I can just add something.
Okay.
From my personal experience. So the thing is that the hemoglobin levels are different. And personally, I noticed that after my period, my hemoglobin would drop a little, but after some time, it would go back to what it usually is. Everyone's hemoglobin is different. There's an average, but other people, let's say women's hemoglobin is like somewhere maybe let's say 11, 12, 13. But there are people who are surviving and full of energy and healthy and thriving with a hemoglobin level of even let's say 8. But for another person, for me, who my hemoglobin level is 13, if my hemoglobin was to drop to an 8, it would mean I would be sick. I don't know if that makes sense. So let's say for a woman who says whenever she's on her menses, because of the blood loss, even though it's normal blood loss, she experiences anemia. I think it's important to see what her normal hemoglobin is, because maybe it's not really being triggered by the periods. Maybe even unprovoked, her hemoglobin is very low. So then with the blood loss of periods, it then even it worsens. Yes, so that was what I wanted to contribute.
Thank you, Annie. Doc, you were the last person that I'm going to take to comment. If you have any comments, if you don't have comments, it's fine. So, and after we'll have our closing comments or remarks. So, Doc, if you have any comments, the floor is yours.
Yes. So the one comment I had is yes, significant blood loss during your periods can lead to anemia. Yeah. By that I mean excessive bleeding, dysmenorrhagia, and then adding up to what Annie said, if a person already has anemia, that is their hemoglobin levels are low, it can manifest after the periods. But even when a person is not really anemic, as in they don't have anemia as a disease, as a condition, they can have anemia after having significant blood losses through menses. Yes.
All right. Thank you, Doctor. I hope that that is insightful or it answers the question.
Just welcome those who are joining us for the very first time, and they could briefly mention their names or where they are joining us from. I'm not sure if a number of them are from the Voice One Africa group, and we can introduce Voice One Africa to them. So if today is the first time you are joining our conversation, you could just briefly introduce yourself. We'd love to know you. And we'll share the Voice One Africa link in the chat. You can copy it and join us, or you can connect with us on our social media platforms.
Okay, thank you for giving me the floor. My name is Sokojo Linda. I'm a student at the university, and the meeting was interesting, according to me, and the answer to the question was the most important part, and I'm really grateful for it. Thank you.
Thank you. Linda, where are you joining us from, and how did you get to hear about the conversation?
It's one of my colleagues. I'm from Cameroon, Cameroon, and my colleague sent me the link through WhatsApp, and I then decide to join the meeting.
Awesome. Great to have you.
Okay, you may go ahead, Mofo.
All right. Good evening. I'm Moko Zita from Cameroon. I'm a student, and I actually joined the link because a friend of mine sent me the link, and I found it quite interesting. And I'm very grateful to all of you because it was quite an interesting talk, and I learned a lot. Thank you.
Thank you, Mofo, and welcome.
Thank you.
Good evening.
Good evening, Zainab.
Yes, I'm Zainab from Tanzania. I got the link from my friend, and the topic is interesting. So
Awesome.
I'm happy to be here.
Great.
Thank you.
Thank you for joining us, and
Thank you.
welcome.
Thank you.
Anyway, the Joe, I hope it's okay that I hand over to you to do the closing remarks.
Yeah, that's fine.
Okay. Over to you.
Hi, thank you. Hi, everyone. Thanks so much for joining. And I think it's been a wonderful conversation. I believe this is the first episode of the second season for 2021, and I think it's going to be amazing. To our professionals, I mean, everyone here, but to Dr. Mwanza and to Linda, to Annie, we are grateful for all the explanations. And of course, our MC, Genevieve, our host, actually, Genevieve, thank you so much. On this note, I would say that Voice One Africa is excited. We are pushing the frontiers, and we are working with youth across the continent to attain the Pan-African agenda. So let's all stay connected. Let's keep pushing, and what we aim to achieve will definitely come to pass. So on this note, I wish everyone a happy Vows Day in advance, and also cheers, and then bye for now.
Thank you, Dejo. Thank you for that. Thank you, everyone, for your fruitful contributions. This conversation would not have happened without you. So I, on behalf of Voice One Africa, would like to thank you all for not reserving your comments and questions. And yeah, let's do this, man. Thank you so much for your time. Have a good evening. Yeah. Until next time. Bye.
Bye.